Well, I'll tell you one thing. This is a cloth mask, and and I know from being a scientist, you study things in a lab like this, and so what you'll do is you'll test the ability of something to get passed through it. So you blow virus through it, or you blow something through it, you blow even smoke through it, and you see what percentage gets through, what percentage does not get through, and it's this fails at in a lot of ways, but it's a very big success. I will tell you that right away. We instituted a change in hospitals. Now here's what happened. I just want to go back. This is not people being wishy-washy. That's the whole idea is that people are saying that Fauci was wishy-washy. He said no masks. The reason that we were not promoting masks back in March, we should have. Um, we should have. We definitely should have. I'll tell you a little story about a student of mine in a minute here. But we should have been pushing masks way back in March. The reason that we didn't, because they didn't want a run on the PPE masks, the N95 masks. We didn't want there to be a run like there was on toilet paper and is right now again on toilet paper and towel paper, and that there wouldn't be enough for the healthcare individuals. So it was a decision. But then there's this. There's the cloth masks. I'll tell you a quick story. I have a student who was in China last January. In fact, I had New Year's. I had dinner last December. I think it was. She was in China,
The exact wrong time.
and it 1 hour out of Wuhan City. 1 hour out of Wuhan City. And she came back from into the United States. My wife and I had dinner with her and her husband on New Year's Eve, in fact. And she came back into the country, and she said, "What's wrong with you Americans? Why aren't you wearing masks?" And they immediately wear masks. That is just what you do in their world, and they don't have a problem right now. I mean, obviously, there's other kinds of things. There's the way the government controls things, etc. But this does work. There is some data that, well, first of all, there was data that we stopped the spread right away in the hospitals when we told hospital staff to wear just regular, cloth masks, not the regular green masks that I have some around here somewhere. Um, and what we found is that they were getting exposed at a much lower rate, and there was a milder form of the disease was occurring. When you think about and we believe, and this was called, well, what if this represents variolation? I'll only tell you what that word means in a second, but what if this is like a vaccine, sort of like a vaccine effect? And there is some evidence that it did serve to that effect. If you look at the data, if you look at that, I'm talking about just healthcare workers from wearing masks. What variolation is vaccines were the word vaccine came from a person by the name of Edward Jenner. Edward Jenner was an English physician, and Edward Jenner came up with the concept of cowpox. The word cow in Latin is vacca, and so vaccine literally means that which derives from a cow. But Edward Jenner was also aware of another kind of a vaccine that the Chinese were doing. Again, it's the Chinese that were leading the way in this particular story. The Chinese were doing a technique called variolation, in which they would take very microscopic or minuscule amounts. They would cut the virus, smallpox, into small amounts, and they would purposely give it to people a very low dose. And if they developed a milder form of the disease, they developed a better immune response, which is what that really means, and they were protected. So the Chinese have been doing that for years and years and years. So what if by wearing a mask, what happened in the hospitals in New York is that we think that the people were getting exposed with a lower dose, and if they got a lower dose, they were able to mount a better immune system. When you get an infection, no matter what it is, the clock starts. The clock starts to when you get an effective immune response. Hopefully you do. The older you are, the longer it takes, which is why we have some issues with the older population right now with COVID-19. So the older population has is more at risk for disease, and they develop a less quick immune response. More less time, more time. The more time between exposure to immune response, the more severe the disease. The shorter the time, the better. So if I can make an immune response, if I can cripple the virus and slow it down, its progression, that gives me more time to make an effective immune response. And that's what we were thinking was going on.